Hello, this is Iftikhar Khan. I am presenting a large past outbreak of yellow fever virus under One Health perspective. One Health recognizes that the human health, animals, vectors, ecosystem, and environments all are interconnected. One Health promotes the implementation of its approaches to confront and emerging zoonotic disease threats. Yellow fever is a mosquito-borne zoonotic disease. This virus is endemic in tropical areas in Africa and Central and South America. Large outbreaks of yellow fever occurs when infected people spread the virus into densely populated areas with high mosquito density along low immunity due to lack of vaccination. Well, today I'm going to talk about a specific large yellow fever outbreak back in 2016 in Angola, Africa, in the context of disease fatality rate and international response. As of the 15th of July 2016, according to WHO situational report, Angola reported 3,116 suspected cases of yellow fever with 361 deaths, with a case fatality rate of 10%. Among those cases, 877 were laboratory confirmed. As part of the quick response, World Health Organization implemented incident management system and coordinated multi-agency teams to respond to the epidemic. Interestingly, since the beginning of the outbreak, all 18 provinces of Angola reported suspected cases, placing all provinces at risk. The capital of Angola, Luanda, reported majority of cases with 489 laboratory confirmed cases, um, just about 58% of the local transmission. Besides international response, an immediate response was launched by the Health Ministry of Angola and its partners. But the response to this outbreak in Angola found to be complicated by the limited vaccine supply. The outbreak posed a risk for further cross-border transmission towards Uganda and Congo, the neighboring countries. In partnership with WHO, the Health Ministry of Angola reported that the government uh, had enough vaccine to launch a routine vaccination program, but not to contain an outbreak. WHO supported the government of Angola in the immunization campaign, and people were vaccinated by September 2016 in 18 provinces in Angola, with about 70% of Angolan population covered. The second phase of the vaccination campaign in Angola was announced in the WHO Health Organization, World Health Organization situation report in 2017 to cover 100% of the target population with the yellow fever vaccine. Angola Red Cross also contributed a greater role in emerging vaccination. So, so it should be appreciated that Angola Red Cross contributed a lot to a greater extent to emergency vaccination, and they really did a good job there. Emergency technical support was also initiated throughout the deployment of a regional disaster response team members. In 2016, some 16 million Angolan people were vaccinated in 73 districts of Angola by the Ministry of Health. Of these vaccinated, the Angolan Red Cross Society reached out to about 3.9 million with a radio and door-to-door campaign and mass education included. And along with that, social mobilization uh, campaigns was also in place. The Eliminate Yellow Fever Epidemic, or in short, EYE strategy, launched in 2017 by WHO, is an unprecedented initiative. With more than 50 partners involved, the EYE partnership supports 40 at-risk countries in Africa and the Americas to prevent, detect, and respond to yellow fever suspected cases and outbreaks. In 2016, the yellow fever outbreaks in Luanda, in the capital of Angola, and Kinshasa, the Democratic Republic of Congo, with wider cross exportation from Angola to other countries, including China, have clearly shown that yellow fever poses a serious global threat, requiring strategic thinking of control and preventative measures. The EYE strategy is comprehensive, multi-component, and multi-partners. EYE calls for building resilient urban centers, planning for urban readiness, and strengthening the application of the International Health Regulations 2005. The lack of penetration to the Angolan community levels was identified as a major limitation to early detection and vaccine coverage. There were proven challenges with the detection and confirmation of yellow fever cases, which allowed the quick spread in most areas. In this issue, UNICEF and WHO worked closely as part of their response with CVA branches to render training and basic support. Other potential causes to spread the yellow fever virus infection widely and quickly is because of the reporting delay occurred in all the provinces, and that delayed the emergency international response to be in place. Prompt notification can limit the spread of outbreak quickly. In conclusion, in terms of international response, the WHO and partners supported the uh, government of Angola to control yellow fever virus outbreak back in 2016 in strengthening measures to prevent new cases and to avoid its spread to other countries. In this context, five priority areas were focused. Number one, surveillance and the risk assessment. Number two, vaccination. Number three, case management and vector control. Number four, social mobilization. And finally, number five, risk communication. And finally, just in conclusion, I would like to add the lessons we learned from the outbreak is as follows. Number one, delays in notification will cause quick spread of outbreak by delaying the control and prevention measures. Number two, developing relations with key government bodies and international response support organization is critical. And to implement a disaster preparedness protocol in place on priority basis. Okay, thank you very much. That's all about.